Our spine is a remarkable structure of bones, discs, and nerves. It provides support and allows for movement. Nerves exit the spinal cord through small openings called the intervertebral foramen. These openings are crucial pathways for communication between the brain and the rest of the body. Think of them as busy tunnels that must remain clear for traffic to flow smoothly. However, various issues can cause these tunnels to narrow. Things like disc herniations, arthritis, or even muscle tension can create a problem. This narrowing leads to an increase in pressure within this confined space, which is the starting point for a cascade of health issues that can be difficult to trace back to their origin. This increased pressure doesn't just squeeze the nerve itself. It also puts a strain on the tiny, delicate blood vessels that supply the nerve with essential oxygen and nutrients. These blood vessels are called the vasa nervorum, which translates to vessels of the nerves. When these vessels are compressed, the blood flow is restricted, almost like stepping on a garden hose. This starves the nerve of what it needs to function properly. This state of reduced blood flow, known as ischemia, is a serious condition for any tissue in the body, but it is particularly disruptive for the sensitive and highly active nerve tissue, setting the stage for significant dysfunction and pain. The consequences of this compression can be profound and far-reaching. Initially, the nerve might send out warning signals like tingling or numbness. Over time, if the pressure persists, the nerve tissue can become damaged, leading to more chronic and severe symptoms. The body's natural response to this injury is inflammation, which can unfortunately make the situation worse by adding even more swelling and pressure within the already tight space of the intervertebral foramen. It becomes a vicious cycle where pressure causes inflammation, and inflammation causes more pressure, trapping the patient in a cycle of escalating discomfort and reduced mobility that can impact every aspect of their daily life. Understanding this fundamental mechanical problem is the key to finding an effective solution. For many years, treatments have focused on managing the symptoms, such as pain, without always addressing the root cause of the pressure itself. Doctors might prescribe pain medication or physical therapy, which can provide temporary relief. However, if the underlying compression of the vasa nervorum is not resolved, the symptoms are likely to return. This is why a new focus on directly alleviating the pressure within the intervertebral foramen represents such a significant step forward in the field of spinal health and chronic pain management. When the nerves exiting the spine are irritated, it's not just a localized problem. Among the affected nerves are the sympathetic nerves, which are a key part of our autonomic nervous system. This system controls involuntary functions like heart rate, blood pressure, and even sweating. When these sympathetic nerves become hypersensitive due to pressure and lack of blood flow, they can start to malfunction. They might send out excessive and inappropriate signals throughout the body. This is why a problem that starts in a small opening in your back can lead to a surprising and confusing array of symptoms that seem completely unrelated to the spine, affecting organs and systems far from the initial site of injury. This overactivity of the sympathetic nervous system can manifest in many different ways. Patients might experience chronic pain that doesn't respond to traditional treatments. They might also suffer from issues like dizziness, persistent headaches, digestive problems, or even fluctuating blood pressure. Because these symptoms are so varied, patients often see multiple specialists in search of an answer, undergoing numerous tests that all come back normal. This can be an incredibly frustrating experience, as they are told that there is nothing wrong, even though they feel unwell. The problem lies not with the organs themselves, but with the faulty nerve signals being sent to them from the irritated spine. The sympathetic nerves become more sensitive, because the constant pressure and ischemia act as a persistent trigger. Think of it like a car alarm that has become too sensitive. Even a gentle breeze can set it off. Similarly, these nerves start to overreact to normal stimuli, firing off pain and distress signals when they shouldn't. This condition, known as sympathetic-mediated pain, is notoriously difficult to diagnose and treat. It helps explain why some people with back problems also develop conditions like complex regional pain syndrome, or CRPS, or fibromyalgia-like symptoms, where the pain becomes widespread and disproportionate to the initial injury. This is where a new understanding of the spine's mechanics becomes so important for patients and doctors. By recognizing that pressure in the intervertebral foramen can sensitize the sympathetic nervous system, we can start to connect the dots between a spinal issue and these widespread systemic symptoms. This shift in perspective opens the door for treatments that aim to calm these overactive nerves by addressing the source of the irritation. Instead of just chasing symptoms with different medications, the goal becomes restoring balance to the nervous system by relieving the physical pressure that is causing the chaos in the first place, offering a more holistic and effective path to wellness. A groundbreaking treatment known as sympathetic nerve block with etiological pharmacopuncture injection, or SNEPI, has been developed to directly address this problem. SNEPI is a non-surgical procedure designed to reduce the pressure within the intervertebral foramen. It works by targeting the deep muscles of the back that are often chronically tight and contribute to the narrowing of these nerve pathways. Unlike treatments that focus on the symptoms, SNEPI targets the etiological or root cause of the nerve compression. The core idea is simple yet powerful. If you can relax the muscles surrounding the nerve exit, you can increase the space, relieve the pressure, and restore normal function. The procedure involves a series of precise injections into specific muscles in the back. The primary targets are the multifidus and rotatores muscles. These are small, deep muscles that lie very close to the spine and play a critical role in stabilizing the vertebrae. In addition to the multifidus and rotatores, other muscles can also be used as treatment points. These include the paravertebral spinal muscles and the extensor muscles attached from T2 to L2, specifically the splenius capitis, trapezius, and latissimus dorsi. By targeting these additional muscles, the treatment can be further tailored to the patient's specific needs and areas of tension. When these muscles are in a state of chronic spasm or tension, they can physically compress the intervertebral foramen, contributing significantly to the pressure on the nerve roots and their blood supply. By injecting directly into these muscles, the SNEPI treatment can force them to relax, thereby decompressing the affected area almost immediately and providing relief from the source of the problem. The injection itself contains a carefully prepared solution designed to be both safe and effective. The solution is typically composed of either 0.9% normal saline or a 5% dextrose solution, both of which are well established and safe for use in medical injections. These solutions are chosen because they have the least side effects, making the procedure safer and more comfortable for patients. These solutions are chosen because they are isotonic or mildly hypertonic, meaning they closely match or slightly differ from the body's natural fluid balance, which helps ensure safety and comfort during the procedure. When injected, these solutions cause a temporary controlled change in the local muscle tissue, which helps to break the cycle of muscle spasm and tension. In some cases, a very small amount of anti-inflammatory medication may be added to the solution to help reduce any local inflammation and further assist in the healing process. This targeted approach minimizes systemic side effects while maximizing the therapeutic effect right where it is needed most. The elegance of the SNEPI treatment lies in its precision and its focus on the mechanical cause of the symptoms. Instead of invasive surgery or powerful systemic drugs, it uses a simple physiological principle to restore balance to the spinal structures. By relaxing the deep stabilizing muscles, SNEPI effectively widens the intervertebral foramen, taking pressure off both the nerve and the vasa nervorum. This allows blood flow to return to the starved nerve, calming the hypersensitive sympathetic nerves and beginning the process of reversing the painful and disruptive symptoms that have plagued the patient, often for a very long time. The SNEPI treatment protocol is designed to provide both immediate and long-lasting relief. The typical course of treatment involves a series of injections, usually administered once or twice a week. The total duration of the treatment can vary depending on the individual patient's condition. For acute cases, where the problem has developed recently, a patient might see significant improvement after just a few weeks. For those who have been suffering from chronic, long-standing issues for months or even years, a more extended course of treatment over several months may be necessary to achieve the best possible results and retrain the muscles to stay relaxed. Many patients report a noticeable improvement in their symptoms shortly after the first few sessions. As the pressure on the nerves and blood vessels is relieved, the initial signs of recovery often include a reduction in pain, tingling, and numbness. For those suffering from sympathetic nerve dysfunction, they may find that symptoms like dizziness, headaches, or digestive issues begin to subside as the nervous system calms down. Additionally, SNEPI treatment has shown benefits for patients experiencing neurogenic bladder, insomnia, orthostatic hypertension, and certain autonomic symptoms associated with some autoimmune diseases. By helping to regulate the autonomic nervous system, SNEPI can provide relief for these challenging symptoms as well. This initial relief is incredibly encouraging for patients who have often tried numerous other treatments without success. It provides tangible proof that addressing the root cause of the pressure is having a direct and positive effect on their well-being. Over the full course of treatment, the benefits continue to build. The repeated injections help to break the chronic cycle of muscle tension and pain, allowing the deep spinal muscles to return to a healthier, more relaxed state. This process not only alleviates the current symptoms, but also helps to prevent their recurrence. As the nerves heal from the restored blood flow and reduced inflammation, their function normalizes. The goal is not just temporary pain relief, but a lasting restoration of spinal health and nervous system balance, enabling patients to return to their daily activities without the constant burden of pain and dysfunction. In conclusion, SNEPI injections represent a significant advancement for patients suffering from both new and chronic spinal issues. Importantly, SNEPI has also shown to reduce pain and improve quality of life for cancer patients, offering them much-needed relief and greater comfort during their treatment journey. By targeting the mechanical compression in the intervertebral foramen, this treatment addresses the fundamental cause of nerve irritation and sympathetic hypersensitivity. The results can be life-changing, offering a path to recovery for individuals who may have lost hope. For many, SNEPI provides a safe, minimally invasive, and effective alternative to more aggressive interventions, ultimately helping them reclaim their health and improve their quality of life by restoring harmony to the delicate structures of the spine.